Hello, and welcome back to the Urology Care Podcast, the official podcast of the Urology Care Foundation. We have two guests with us to talk about overactive bladder, also known as OAB. Our first guest is Dr. Eugene Lee, a urologic oncologist and associate professor for the Department of Urology at the University of Kansas Health System. Dr. Lee starts off the conversation by sharing his experience living with OAB. Dr. Kowalik, a urologist and assistant professor, also at the University of Kansas Health System, then joins the conversation to provide a basic overview of OAB from a medical perspective. Dr. Lee and Dr. Kowalik, welcome, and thank you both for joining us on today's podcast.
Thanks for having us.
Yeah, thank you for having us.
Can you each introduce yourself to our listeners?
Sure. I'm Casey Kowalik. I am an assistant professor at the University of Kansas, and I specialize in female pelvic medicine and reconstructive surgery.
And I'm Eugene Lee, also at the University of Kansas. I'm an associate professor of urology and the division director for urologic oncology. And in this podcast, my role is I have overactive bladder. And so I will be playing the role of the patient today.
But not really playing, because you actually have.
Yes, that is absolutely true. Yeah. I guess I said that correctly. Yes, I have overactive bladder. And so that's why I am part of this podcast. And so thank you for having me.
Well, welcome to both of you. We're excited to have you with us today. So, Dr. Lee, I would like to start the conversation out with you. So before we kind of jump into your experiences with overactive bladder, or OAB, as we can refer to it throughout the podcast, can you just give a brief explanation of what OAB is for our listeners who may not know?
Well, I think that Dr. Kowalik probably can give the more official medical definition. For me, what it means is that having severe kind of urgency and frequency of urination that is really kind of bothersome and affects kind of daily living, the inability to kind of hold urine and delay urination. That's kind of where the symptoms primarily lie for me. That's kind of where I'm at.
Okay. And what were the common symptoms that you happen to experience?
Yeah, so I think, for me, growing up as a kid, everybody used to always say, my parents, my grandparents were always like, gosh, Eugene, you go to the bathroom all the time. And so it never really meant much to me until I became really a urology resident. And then I began to hone in on those symptoms and thought to myself, gosh, this is probably pretty abnormal. So, but yes, for me, it's that typical, like, once it hits that I've got to go to the bathroom, I have to go to the bathroom. Every store, every restaurant that I go to, I can tell you where the bathrooms are in pretty much every place that I go to. And, it's kind of always in the back of my consciousness. Even, before we started our podcast, I'm like, man, I better go to the bathroom before, whether I feel like I have to or not. It's just trying to avoid those situations where it's like, oh my gosh, I've got to go to the bathroom.
So you had symptoms since you were little, but you didn't actually get diagnosed until you were older. Was that something that you went to see a doctor for, or just being a urologist, you were kind of like, oh, hey, I probably have overactive bladder?
So I'm going to be completely forthright. I am a terrible patient, and I am the typical, what everybody says, that physicians make terrible patients. I've had symptoms. I've kind of treated myself off and on throughout the years. I will touch base with partners periodically, before it was one of our former partners, and then now it's Dr. Kowalik, just in passing, hey, you think this would work? And then, but yeah, it's a true kind of quote unquote diagnosis with a physician. No, I haven't seen anybody officially.
Okay, so you talked a little bit about what it's like dealing with it, knowing where all the bathrooms are and everything. But aside from that, what has the experience living with OAB been like, and how has that affected your life, both personally and professionally as a doctor with, I imagine, a very busy schedule?
Yeah. So I think clinically, it actually shockingly doesn't bother me as much, from my day-to-day work, from a clinical standpoint. But what I can tell you is that, I do a lot of administrative work, research, meetings, and things like that. And so there are a lot of times where I'm sitting in meetings where, I'm thinking to myself, gosh, we've got to wrap this up really quick. And now most of the people around me, most of my team, they know that if we have a long meeting, I'm probably going to take a break. So it's kind of one of those understood. I would say in my personal life, traveling, my family and I, we love traveling. We fly a lot of different places. During COVID, we've been driving more. And so that obviously throws a little wrinkle into it where, I find myself kind of dehydrating during travel days to avoid the frequent bathroom breaks. I joke around with people too. I've got a 6 and a 9-year-old, and because I've got to go, I'm always like, hey, you guys need to go to the bathroom, right? And then so that it gives me an excuse, because surely one of them has to go at any given time. But yeah, that's how it kind of affects me from a personal and from a professional standpoint.
Okay. And what are some of the things that you've learned, and what do you think is important for other people to know who are living with OAB?
I mean, I think there's a couple of things really that I would say from my standpoint. One is that, and this is where I'm going to be completely honest, like I kind of flip back and forth between having my patient hat and physician hat, because do I listen to my own advice all the time? Not necessarily, but one of the things that I think it's really important for people to know is that there's really a lot of different types of therapies, and very effective therapies. And it's not always a one size fit all. Medications may not work for everybody, but there are different types of medications. And then there's a lot of different procedural types of therapies that are very effective as well too. And so I think sometimes we as patients get frustrated, and we don't have a lot of patience with it. And so just kind of going through the process of going through each line of therapy and really understanding that this is something that can be treated. And also the fact that it may not take away symptoms completely 100%, but there are ranges in terms of benefit. And so understanding that as part of it as well too.
Great. Thank you so much for that. So, Dr. Kowalik, I want to bring you now into this conversation to give a little bit more insight into the medical perspective of OAB. Dr. Lee kind of gave a brief explanation of OAB, from the patient perspective. Can you dive a little deeper into what overactive bladder or OAB is?
Sure. So overactive bladder, it's that gotta go right now type of feeling that you can get. And sometimes if you wait too long to use the bathroom, that's when it may result in a urine leakage episode. There can be symptoms like urinary frequency, going basically more than 8 to 10 times per day, maybe getting up multiple times at night, or having urine leakage that's associated with that strong urge to use the bathroom.
And how common is OAB?
OAB is extremely common, and it can affect up to 1 in 4 adults over the age of 40. Often people are embarrassed to discuss their symptoms. And so I think a lot of patients with OAB don't realize how common it really is.
Are there certain groups of people or certain people who may be at a higher risk for developing overactive bladder?
Yeah, patients that may have severe constipation are more likely to have overactive bladder symptoms. And that's basically because the bowel is full of stool, leaving less room in your pelvis for the bladder to distend when it's being filled with urine. Other groups of patients that are more likely to have overactive bladder would be patients with certain neurologic diseases, so Parkinson's disease, or if you've had a stroke, or you're at higher risk for developing overactive bladder.
Okay. And so Dr. Lee had mentioned, the symptoms that he had experienced, and you kind of talked about that gotta go feeling. Is that the only symptom that someone would experience, or are there other symptoms that may go along with that need to use the bathroom all the time?
So in addition to maybe feeling that strong urge, like I gotta go right now, people with overactive bladder often get up several times at night It's fairly common to get up at least once a night, but when you start getting into 2, 3, 4 times a night, that can be really disruptive to somebody's quality of sleep. Also, leaking urine associated with that strong urgency can happen with overactive bladder.
Okay. And is there something in particular or things in particular that directly cause OAB? Can someone have just a small period of OAB, but not have it be something that they experience throughout all of their life?
Yeah, there can be. If you're struggling, like I mentioned, with constipation, that can cause OAB symptoms. If you're drinking significant amounts of caffeine, that will also cause OAB symptoms. The vast majority of people, though, this is a chronic condition, and there isn't a cure for it, but there are really good treatment options that can help to control the symptoms.
And how is OAB typically diagnosed? Is it just based off of symptoms, or are there actually tests that can determine if someone has OAB?
It's typically diagnosed based on symptoms plus a urinalysis. The urinalysis testing is done just to make sure that you don't have an infection that could be a cause of your overactive bladder symptoms. Your physician may also order additional testing like an ultrasound of the bladder or a specialized bladder study called a urodynamics.
Okay. And what are some things that people may not know about OAB?
I think that it's very common, as I mentioned, and bringing it up to your physician is a great idea, particularly if it's bothersome to your quality of life. The other things that I think people may not know about overactive bladder, one is that weight loss can significantly improve overactive bladder symptoms. It can also help other types of urine leakage symptoms. Also, that bladder training or pelvic floor therapy exercises can actually be done at home and can also help improve your symptoms. And we have a great resource on the Urology Care Foundation website with these exercises.
Awesome. Thank you. So now let's bring back Dr. Lee to join Dr. Kowalik in a discussion on managing OAB on the go. Dr. Lee, as a doctor, we kind of talked a little bit about this previously. I'm sure your work days are quite busy, and I know a lot of people can probably relate to that, having a job that may not allow them, to have multiple bathroom breaks. The first job that kind of comes to mind is a teacher, for instance, who is teaching a class and, may not feel comfortable to just leave the room to use the bathroom. I'm sure there's plenty of other jobs that, kind of have that same atmosphere. So what are some of your best tips that you can share on how you manage your OAB on a daily basis that other people may be able to take with them and use in their life? Stay tuned for part 2 to learn what Dr. Lee and Dr. Kowalik have to say about managing OAB on the go. You don't want to miss it. Patient resources provided through the generous support of Astellas. This podcast has been brought to you by the Urology Care Foundation, the official foundation of the American Urological Association. For more information on today's topic and for all things urology health, visit urologyhealth.org. That's urologyhealth.org.